Okay, I'm Tiana, and this is my peripheral IV start extra credit video. For the purpose of this video, this is the patient's arm. This is the most distal, this is the most proximal. So like, cool. I'm gonna start now. That was knock, knock, knock. My name's Tiana. I'm gonna be your nursing student today. I'm gonna pull the curtain and shut the door to provide for privacy. I'm gonna use hand sanitizer. Can you tell me your name and date of birth, please?
Joseph Smith, 1953 or something.
I'm looking at your wristband and I'm identifying you with two identifiers. Your wristband also says Joseph Smith, date of birth 1954. Do you have any allergies?
Iodine.
Iodine, allergic to iodine. That's what your wristband says. I'm looking at provider's orders here. And it says that he wants us to start an IV because you need some fluids. So we're going to do that. Do you have any questions?
Nope.
Okay. You have no allergies. I'm going to use gloves as appropriate. I did hand hygiene. Good. Okay, so I have all my supplies here. They're intact, not expired, and appropriate for my client. My saline is good. I'm going to put the linen saver underneath of your arm here. Are you in a comfortable position?
Yep.
And then for the purpose of this, I would have real patient in a dependent position to help with, have the gravity help with us in our placement of the IV to see the, I'm going to put on the tourniquet 4 to 8 inches above, tightly, and just to see what vein we want to work with today. I see you have a good one right here. Palpable, good. Okay, I'm gonna do that. So I'm gonna take this tourniquet off here. We'll get it cleaned up and get it ready. I'm gonna first get my J-loop ready here. So going back, and getting the air. I'm not touching the end. I'm gonna flush it through. There's a little bit of fluid coming out, which is okay. So now I'm going to put on my gloves and clean the area. And then I'll put the tourniquet back on and we'll get started. Schnazzy gloves. Okay. I'm going to use an alcohol prep pad here. Clean the area for 30 seconds. And then I'll let it dry for 30 seconds. Okay, it's been 30 seconds. I'm going to reapply the tourniquet. Okay, I'm going to open my IV catheter. I have a 20 gauge, which is appropriate for my client's size and position. I'm going to take the cap off, ensuring that my bevel, the tip of my catheter, is intact. My non-dominant hand, I'm going to hold down below the site of insertion to keep the skin taut. And I'm going to insert at a 30 to 45 degree angle. Beveled is up. I'm gonna insert, little pinch, 1, 2, 3, inserting. And I'm gonna insert until I get a flash of blood. After I have a flash, I'm gonna further the whole needle 1/2 centimeter. And then after that, I'm only gonna advance the catheter, pulling the needle out. Okay, so I'm holding taut and now I'm holding pressure here, clicked. Click it. That would go right to the sharps if I could. And then undoing my catheter. I'm gonna attach my J-loop here. Still holding pressure to prevent from bleeding. I'm gonna flush just a little bit. Okay, I'm gonna pull back some blood for blood return. I'm still in there. Then I'm gonna continue flushing. Then, still holding tight, keeping pressure here, holding this down. I'm gonna place my Tegaderm. This is done to prevent to keep my space sterile with still being able to observe the site. I'm doing this in a way that I can still switch my J-loop if needed. And that's on. I'm going to clamp this so we don't have constant blood return. So that's on and in place. I'm going to tape this against my patient's skin. I'm gonna unclamp that. I will dispose. I'm all done. Are you in a comfortable position? And is there anything else I can do for you?
Nope.
Okay, I'm gonna clean up my supplies. I would label this as well as label my Tegaderm as well as document catheter size, date, and initials. And I will put my sharps in the sharps container. Dispose of everything else. Is there anything else I can do for you?
Nope.
That'll be all.